I have a very good friend, a cardiologist and an ER specialist, and we are going to hear his views on how he thinks yoga impacts our health and well-being. So I welcome you, Subh.
Thank you.
Thank you so much for joining me on my first broadcast. And I would love to hear from you about your experience in the hospital and personally. So before I go for that, I would like to know, how are you breathing today?
Well, thank you, Sangeeta, for inviting me to your wonderful program. This is right off the bat, you asked me a tough question because breathing is so essential. We don't pay attention enough to breathing, I feel. It's on autopilot most of the time. Mm-hmm. You don't pay much attention, but I think we should. If you start paying attention to your breathing, then I think wonderful things can happen to you. Really wonderful things, miraculous things, and that's what people call miracles. So definitely, I don't know if I'm really breathing correctly, but that's my intention every day. I work on my breathing every day, and that's my intention. But definitely, I think today we are going to discuss a lot about breathing.
Yes. Thank you. And, I know you for a few years and then we lost contact. So almost a year is when we really started connecting back. And I know you're a cardiologist and ER specialist, but I would like to know, and I would like our friends to know, what brought you to yoga?
Right. Well, you're correct. I did emergency medicine, and then I moved on to do cardiovascular practice. And I can tell you that I have been doing yoga for quite some time, for a long time. And I was lucky to be born in a country which is the birthplace of yoga. So I was born in India. And in India also, I was lucky enough to be born in a city which is known for these things. People come there for learning yoga. There are a lot of enlightened masters over there. So I didn't have to think twice about it. This was growing up thing, it was part of living. Mm-hmm. I was living life with them. Mm-hmm. So I know that when I was 4 years old, I got introduced to it. A very powerful, enlightened yoga master, a very renowned yoga teacher, very simple man. Mm-hmm. Very, very simple man. That's what you learn. Very simple man. He was 70 years old, by the way. 70. Mm-hmm. Let me repeat the word 70. Mm-hmm. 70 years old. Gray hairs. Everything was gray. Athletic. Really athletic. Mm-hmm. Brimming with happiness.
That's what yoga does to you.
Joy, bliss. These things, because when you're a child, you're innocent.
Yes.
And you are, so those are the impressions. Think about that. I am much older today, but these are the impressions I still remember of that teacher till today. So those were the impressions which are still on me as, when I was a child. So blissful person, happy, fit, athletic. I was like, what do you want to be when you grow up? And this guy used to come in a bicycle. Used to go everywhere on a bicycle. So he used to come and teach my uncle yoga. And I was a kid, 4-year-old. And that was my first experience of seriously learning yoga. Because I was a kid, I was flexible, I could do it. And that was one-to-one teaching. He didn't ask for anything. I was a kid, and he took me under his wings. And he taught me for up to 10 years.
Wow, you were lucky.
I was lucky enough. So he taught me for 10 years. So I learned all these difficult postures and breathing techniques and everything. And then, and he was 94, by the way, when he passed away. Not from any illness. It was a sudden, quick thing. Boom. Mm-hmm. The next day, you know that he was gone.
Mhm.
He lived a very fruitful life, extremely healthy life till the age of 94. So that's a great testament to the
Yes.
power of what exercise, meditation, pranayam, breathing, etc., can do for you, right?
Yes.
So, and then the second part was I was lucky enough that when I was in school, there was another teacher over there who was also teaching us yoga. And there was a third teacher. So I was learning from various teachers different techniques. So that was my first, impressions of yoga growing up. And then medical school happened. So I went to medical school and I got westernized. Not in a bad way, not in a bad way.
Yeah, yeah, sure.
So what I'm saying is that because the medicine which is taught throughout the world is Western,
Mhm.
so you kind of moved away. So I kind of moved away from what I was doing, and started learning about chemicals and
Mhm.
disease processes and the biochemistry, the physiology, the anatomy. And this was
Mhm.
a great experience because that's why I think it makes us more, the narrative needs to change because we understand anatomy. We understand the human physiology. We understand the human biochemistry, the pathology. But if we incorporate these other practices into medicine, then I think it can be a very powerful tool. So
Absolutely.
right, so that was my first experience. Then I got away from it in medical school. I didn't do any yoga for 4 or 5 years, and from there I came to the U.S. and I was busy learning medicine and emergency medicine and then cardiovascular medicine. And I traveled across the country and I went to top universities, met with the top minds of the country, really.
Mhm.
Great hands, great respect for these teachers. But I learned that despite the advances we have made in medicine, we have really helped patients and people. We have impacted survival. We have improved the longevity, the lifespan of individuals. But somewhere we are still coming short.
I think we have lacked a little bit on prevention.
Prevention and also, I think, treatment.
Yes.
Both. I think definitely we can prevent a lot of these morbid conditions,
Mhm.
but also it may have some role to play in at least helping us manage some of the chronic diseases. When you talk about heart disease or blood pressure or diabetes or atrial fibrillation, which we are seeing an epidemic of, obesity, you name
Mhm.
it. So I think it has a lot of potential. Psychological disease, we talk about mental health illness issues.
Mhm. Mhm.
So I think addiction, a lot
Mhm.
of addictions are there. So I think everyone wants to live a limitless life, but we are not able to experience that life.
Yes.
And we are trying to experience that life through addictions.
Yes.
So, does that answer your question?
Yes, yes, definitely. And then we move on to the next question that I wanted to hear from you. What is your experience in terms of, I know you do a lot of research on subjects. So what is your experience and research? What is the scientific research saying about yoga and health?
Yeah, I think that's a great question. To understand that, I think we need to first understand that when we talk about yoga, it conjures up a certain image. Now everyone is doing it. I can tell you that when I told someone that you should have, someone was very stressed when I saw them in the emergency department. And I said, you need to meditate and do yoga. I don't think they understood what I was saying
Yeah.
at that time. But today, everyone is receptive to that idea. People are open to that. I think because slowly it's percolating
Yes.
and there is benefit and there is increasing evidence of the use and benefit of yoga as a complementary lifestyle
Mm-hmm.
for what you're looking in life. So let me explain that in a little bit more detail. So when you talk about the components of yoga, what the image which comes off is physical postures.
Yes.
Someone sitting in meditation or pranayam or breathing, So
Mm-hmm.
that I think is a great start.
Mm-hmm.
First component of yoga, which because it gives you a global well-being,
Mm-hmm.
social, global well-being. But then if you go a little deeper, then what about your emotions, your thoughts?
Mm-hmm.
Start knowing a little bit about that. So it is great for your psychological well-being, and it helps you deal with your stress levels. Stress levels are very high, right? It's at an all-time high, despite the technological advances we have. Now you have a car, you have a home, you have electricity, you have clean water, you have hospitals around you. But despite that, the stress levels faced by this generation are pretty high.
Mm-hmm.
And there's a lot of mental health illness. So I think that's the second component of yoga, where people are not aware about their pain. They feel the stress, but they don't know where it is coming from.
Mm-hmm.
I think there's a disconnect there.
Yes.
So yoga will help, and it has been shown in studies that it helps you understand the reason for your stress.
Mm-hmm.
And it makes you resilient to deal with that stress better. So that's the second component of yoga.
Yes.
And then the third component is awareness of your mind-body complex. So we know that humans are a physiological, psychological construct, right? So now there is a concept of an embodied mind. So what that means is, in talking medically, is that when you say I am Sangeeta, you have an identity. I say I'm Subh, I have an identity. Where do I get that identity from? So these are my sensory perceptions, my physical perceptions, the interplay of various organs. So, and then the processing of that information. And then it comes back through different pathways to lead to either a complex decision making, abstract thinking, or a motor activity. So I say, okay, I am going to eat the apple. A lot of neurons are involved, and the information travels down, and we are getting information to our hands, to our eyes, to see the apple and pick up the apple. So so that's the third component of yoga, is awareness of this mind-body complex. And the fourth component today, which I don't think we need to discuss that today, is understanding the deeper energies, transcendence, the spiritual discipline of yoga. That's the fourth component of yoga.
Mm-hmm.
So there is a lot of evidence now today in the medical literature about the benefits of yoga when it comes to cardiovascular disease, or when it comes to quality of life in cancer patients, when it comes to diabetes management, atrial fibrillation. Now we know about the plasticity of the brain, that how we can impact that.
Mm-hmm.
Definitely in the plane of mental disease. So when you talk about depression and anxiety and whatnot,
absolutely,
many studies are showing significant benefits in those realms.
Are there any other information we can share with our friends?
Yeah, so we were discussing about this a few days ago. So I delved deeper into these things, and I was able to find some valuable information. So let me see if I can. I'm going to share a screen. I have made some slides about benefits of yoga and how it works. So let me see if I can do that for you. All right, give me a second. Boom. I'm sharing this screen with you. So if you can see on your screen.
Yes, I can. I hope our audience can too.
So this is a slide about yoga and hypertension. Now, there are multiple studies. I can tell you that there are like more than 100 studies where people have looked at the benefit of yoga and hypertension. So what folks have done is that they have looked at 50 trials or 60 trials or 10 trials, and they have done something called a meta-analysis, where you are trying to find whether yoga compared to other methods or placebo is beneficial or not. So when you look at diastolic blood pressure, the lower number, roughly an 8 millimeter drop of blood pressure.
Wow.
When you look, yes, impressive. And when you look at systolic blood pressure, it's roughly around 10 to 12 millimeter mercury. So this is huge.
Yes.
right? As a cardiologist, I can tell you that I have patients who are suffering from hypertension, and they're on 3 or 4 different medications. So if we can introduce a non-invasive method, a non-pharmacological method,
Yes.
I think this is a game changer. So now it's possible that we might be able to not add a medication or reduce the number of medication they're already on,
Yes.
and take away their risk for having side effects from the medication.
Yes.
So these are major findings. There are other trials. So when I was doing the research, I found that why do we care? Why should we care about reducing blood pressure, right? So you will be happy to know, your viewers will be happy to know, that just a 2 millimeter reduction of blood pressure leads to a 15% reduction of cardiovascular risk. 15. And if we can reduce the systolic blood pressure by 10 millimeter mercury and the diastolic blood pressure by 5 millimeter mercury, there is a 30 to 40% reduction from death from cardiovascular disease.
Wow.
Right. So that's a huge thing on the population level. And you saw that on an average, the drop of blood pressure is 10 millimeter mercury with yoga. So imagine the immense benefit.
And is that not keeping in mind the other lifestyle changes like the diet and other things? This is purely yoga.
Correct. So we are talking of just one thing, because these are randomized trials. So you're trying to reduce confounding. You're trying to reduce noise in a randomized trial. So the way to reduce noise in a randomized trial is to have a large pool of participants. And because you are not going to have similar number of types of participants, right? So if you take a pool of, let's say, 500 people, they have different ages, gender. Gender is easy to control, right? There's only 2.
Right.
But look about presence of, let's say, hypertension, presence of diabetes, presence of heart disease, eating. When they say eating, I mean, boy, you can't even control for that, right? Because someone is eating something, everyone is eating something different.
Yes.
So that's where the statistical power and methodology comes in.
Yes.
You take an enough large group of people,
sample size,
randomize them.
Yes.
So when you randomize them using statistical randomization tools, then you are minimizing noise.
Yes.
Still going to be some noise, but you're hoping that the only intervention which you're going to study is yoga in this case. It could have been a drug, it could have been any procedure. So that's how you do it. So they did a randomized trial and it shows significant benefit.
Impressive.
Yeah.
Other studies to share?
Yeah, so let me show you that. So this is about, blood pressure, but let's talk about, let's say, diabetes.
Okay.
So I wanted to show you, our viewers, what diabetes is. Give me 1 second. This is all new to me as well.
You take your time. It's my first one, so.
Let me share this screen of diabetes with you guys. So here it is. So if you look in the middle panel, this FPG stands for fasting plasma glucose. So this is your fasting blood sugar. This is your A1C on your left, and your right is the oral glucose tolerance test. All right. So when you go to your doctor and they say, come fasting, if your sugar is less than 100, you're golden. You do not have diabetes. But if you are between 100 to 126, then that's impaired fasting glucose. Use the word pre-diabetes. But when your blood glucose exceeds or is equal to 126 milligrams per deciliter, then the diagnosis of diabetes is made. And then there are some other tests. You can do an OGTT, which is 200, and hemoglobin A1C is more than 615. So keep these numbers in mind. Look at the middle panel is in the mind, because you are looking at a level of 100 to 126. So 26. If it exceeds 126, that's diabetes, right?
Right.
So now let's say we take this group of individuals and you go through yoga.
Mm-hmm.
What do you see? Let's see the benefit. Boy, I was blown. There's a drop of sugar, fasting sugar by 24 points.
Wow.
And hemoglobin A1C by 0.5. So these are big numbers. All right. So imagine if someone is 110, fasting sugar, right? So you are pre-diabetic. You have impaired fasting glucose, and now you are in a yoga program, and you drop your points, let's say by 15 points. Now your blood sugar is 95. So now from a pre-diabetic, you became normal. So that's the power of medicine.
Wow.
So yeah, I mean, it's amazing. So what happens with diabetes? What's the mechanism when you get diabetes? It's a lifestyle disease, right? 90 to 95% have type 2 diabetes. There is a predilection to eat high, energy dense foods. There's inability to stop eating that food.
Right.
Well, your BMI goes up, and boom, you get insulin resistance, and you get diabetes, right? So that's the mechanism of action. So how does yoga help? So yoga helps here, by, of course, you are indulging in physical activity. So it helps you there. But the second component of yoga is what comes into play here. Because most people indulge in emotional eating. So the second component of yoga, it's about knowing and deciphering your emotions, your thoughts. And with breathing, you start getting more control of your emotions and your mind.
Yes.
That's the psychological benefit, right?
Yes.
So that component of yoga comes into play. Plus, of course, the first component, because it prepares you for the second component.
Yes.
But the second component is what comes into play here and is helping you battle diabetes. So that's the mechanism of action of controlling diabetes. So there you go. I mean, you can control diabetes. We can talk about many conditions. I won't share a slide here, but let me tell you the depression and anxiety scales, they go down by 30%.
Wow.
I mean, that's a huge win.
And I see that in my students as well. I mean, when you were talking about breathing and diabetes, the only thing that was coming to my mind, of course, I don't talk in numbers when I'm teaching, but something I always tell my students is get your breathing right and your body and your mind will follow.
Correct.
Breathing is so important. The whole, as you said, it's a game changer.
It is. Since everyone is watching, I just wanted to briefly show them, because this is an impressive slide.
Sure.
I just wanted to share this screen with you. Give me a moment. And here you go.
Share everything you have, because we are here to watch and learn. So
here you go. This is a slide on, if you can see on your screen, this is atrial fibrillation. So atrial fibrillation is an epidemic right now, by the way. So let me give you some statistics. We have 3 to 6 million individuals who have atrial fibrillation in the US alone, and roughly around 33 to 35 million individuals in the world have atrial fibrillation. And I have a keen interest in atrial fibrillation. I was a cardiology fellow and I did electrophysiology training. I was doing ablation of atrial fibrillation in Chicago. So this study assumes importance. In this study, they took a group of individuals and they found significant reduction of symptomatic and asymptomatic atrial fibrillation burden. So this is huge. We have an epidemic of a condition, and I think yoga can help us deal with this condition in a way. And what's the mechanism? The mechanism is that, and I think this is a mechanism for a lot of diseases, unfortunately. So when we talk about atrial fibrillation, just before any AFib episode, there is a surge, an extreme surge of sympathetic nervous system, of autonomic tone. There's an extreme surge. What that leads to is continued persistent systemic inflammation, oxidative stress, and that leads to endothelial dysfunction. So endothelium is the lining of our blood vessel, and that leads to changes in the substrate. So when we say substrate, we are talking human physiology. So AFib, atrial fibrillation, lives in the upper chambers of the heart. So imagine that area being inflamed, angry, right? Inflammation is anger, and a lot of oxidative damage to that inner surface of our atrium. And it starts ballooning, gets bigger. There's increased stress levels going up, right? The stress is high. And your hypothalamic pituitary axis is acting up, leading to release of our stress hormones. There is decreased imbalance between the two components of the autonomic nervous system. And that leads to initiation and perpetuation of diseases like arterial hypertension, diabetes, and in this case, atrial fibrillation. So when we do yoga, when we do breathing exercises, when we become aware about our stress, then what happens? We increase our baseline parasympathetic tone.
Yes.
That's number one. We suppress the extreme fluctuations of these components of the autonomic nervous system.
Yes.
And that leads to decreased frequency of atrial fibrillation, and similar mechanisms are in play for hypertension. And we minimize atrial fibrillation remodeling, the atrial remodeling which is happening, we minimize that.
Yes.
I think this is very important to understand. Once we understand these things, now you understand the human physiology.
Right.
So once we incorporate these westernized concepts of medicine to yoga, I think this will hopefully get us more people involved.
Yes.
Because now they see that there is, physical benefits, but there's psychological benefits. Perhaps, as they say, there might be spiritual benefits.
There are. I'm testament to that.
That's something you have to experience on your own.
Yes. Everybody's journey is unique that way.
So I think we have enough ammunition. That's what I was trying to show you the slides.
Yes.
The science is solid now. The science is behind. And I wanted to share these slides with you. There are so many studies. I mean, once Sangeeta said, let's discuss about it, I have burned the midnight oil. I have read like 50 studies in the past 2-3 weeks. And I don't want to belabor everyone, but basically, the science is behind us now.
Yes, thank you. I really value the time you have put in. And I know you have done a lot of research and spent a lot of extra time out of your calls and hospital work that you do. My next question I had was, so when you have your patients, when cardiac patients come to your practice, what is the yogic advice that you give them? And how do you sort of marry the Western and this Eastern philosophies?
Well, so again, I want to clarify, it's not a philosophy.
Right.
It is science. It is a tool.
Yes.
So, I think that people are more open now to these ideas. It is in the social media. It is in the newspapers. The United Nations has an International Yoga Day. Yes. So I think it has entered the lexicon of the common man.
Yes.
So even if I'm in rural communities or in top academic centers, urban centers, people are familiar and are receptive of yoga.
I'm so happy to hear that.
Yes. So that's a game changer, number one. So that is a game changer because now you can talk about it.
Yes.
Right? And the second thing is, when I talk to my patients, and second, it's coming from a physician.
Yes.
So, right? So that's the second thing, right? And the third thing is that I show them the science. So I share with them, and I can again share a screen with the viewers today. I share with them my work, which I have done. So, it's not something which I can discuss with them in 20 to 30 minutes, which I get with every patient. This is a lot of information. Even today, when we are talking, it is not enough time to, and you cannot talk the same thing with every person, right?
Yes.
It's hard.
Yes.
And then there's a lot of paperwork involved. So 20 minutes of the 30-minute time is spent in paperwork, unfortunately. I would like to spend 20 minutes with my patient, but unfortunately 20 minutes are spent in paperwork, and you are able to spend maybe 5 minutes with your patient.
Yes.
And then you're talking to them about other things, right? You're talking to them about their symptoms, what medications they're saying, what their complaints are. You're trying to help them through that process.
Yes.
You're examining them. So now maybe, I say maybe, a minute is left now for you to discuss nutrition, lifestyle, and yoga, physical exercise. So only a minute is left with you to discuss that with your patient. So one thing I did was that I made sure that when I talk to my patients, I look the part. So you know what I'm saying, that you cannot be a smoking, obese cardiologist.
Yes.
And then you are telling the patient that, hey, listen, my heart is okay, so I'm smoking. But your heart is not. So I'm telling you, it doesn't work.
Yes.
So you have to look the part.
Yes.
You have to have the experience of having done those things yourself.
Yes. Walk the talk. Yes.
Correct. So I think maybe we can share a screen here. I can share. That what I did was that I worked on a book. I made a channel. So I gently nudge my patient. I say, listen, guys, you could, go to my channel, learn a little bit more about me. And that's how I tell them. And I think that has worked for me because, and hopefully it will work again all the time. Here, I'm going to share a screen with you.
Sure.
I direct them to my YouTube channel because it's easy.
Yes.
Because then folks can see you in action. So what I do is that I enter their kitchen. I enter their lives. That's what I do with my patients.
Yeah.
So a lot of my followers, subscribers are my patients. And they give me ideas. They ask me questions. They email me. I have given them my number, my email address, everything. We are active on social media. We are on Twitter, Facebook, you name it. And then there's a book on yoga. So when they see their doctor in action, then I think it motivates them.
Yes.
So then they tell me, you know what, doc, I'm going to change myself. And please don't put me on this blood pressure medicine.
Give me some time. Yeah.
Give me 3 months. And I promise to you that I will be better.
Mm-hmm.
And I've changed. Luckily, I'm very grateful. A lot of lives have changed. And people come to me and they've lost a few pounds. And they say, you know what, this is good. I'm going to do it for 3 more months. Because my goal is still to reduce their blood pressure.
Yes.
We can't keep waiting for them. But if they lost a few pounds, they have walked that path. You have to give them time.
Yes.
And in my opinion, it takes roughly 6 months to start seeing the true effects of lifestyle modification and yoga and breathing and pranayama.
Yes. I do the same. I tell the same my students. Give at least 4 to 6 months before you decide it's nay or yay for you, That's important because it's not a overnight shift.
Correct. So, it's working, hopefully.
Nice. That's so nice of you because one of the passions I have, and that's why I named it Yog from the Heart, because a lot of us are doing a lot of good stuff, but I want to identify through this work, I want to identify people who go above and beyond what is being asked from them, and also the people who really truly work from their heart. And that is something I see in your work, in your passion for it, that you're really going above and beyond. It's easy for you to prescribe a medication and say, okay, here, you're diabetic, you're hypertensive, you have heart disease, go for this medicine, but you are having a better vision for better health for them. And that's why you are guiding them into this. And the other thing I feel is we all have to take not some, but a lot of responsibility of our health in our own hands too. You can't just always say, the doctor, give me the medicine and make it right me, right?
Yeah, I mean, thank you for those kind words. Certainly, I don't lose anything. In fact, by saying these things, I will actually make people healthier.
Yes.
So I actually make more money when people are coming to me and asking for medicines, and I'm happy doing procedures. So, and a lot of my colleagues will say, "What are you doing?"
I know. I was going to ask you that. How do you deal with that pressure?
Yeah, it's harder, right? And then and everyone is looking, unfortunately, for a miracle pill, right? Mm-hmm. This pill is going to cure. So I think that's also a conversation I'm having, that this is a shared decision making between me and my clients and participants and patients, right? So this is becoming more aware. This awareness. People are not even aware.
Yes.
Right? They are not even aware of their condition or their disease or the physical distress or the emotional stress. And what happens is that, I see a lot of patients who come to me for palpitations, which is fast heart rates, not realizing what is the source of that palpitations.
Yes.
Very easy for me. I could implant devices. I could put them on beta blockers. But what I'm trying to do with them is try to understand what is driving the palpitation. Once they become aware of that situation, so that's called situational awareness, they enhance through yoga. Now you are equipped to deal with that stress in a better way.
Yes.
And then you can deal with your palpitations. Perhaps they will go away because that was a somatic response. Your body crying for help because of that stress.
Yes.
So once you become aware of that, then you may not need the medication. You may not have the side effects. So I think that's where I enjoy that. That's my passion.
Yes, I can tell. I can totally tell. And I wish you so much luck, that you are able to make people more aware of this body, this temple that we get to live and experience this beautiful life journey. And with that, I also wanted to ask you to briefly touch, now that we have been going through this very tough times, and you are in the hospital seeing COVID-19 patients and all. What is your advice on that? What are you seeing with that? I personally experience, I know that to be able to breathe better is really helps us raise our immunity and helps us with all that. So what would you advise on that?
Well, so I have a video on my channel on the guided deep breathing tutorial. We have published some videos on breathing techniques. Definitely, I can tell you from a medical point of view that we don't even utilize the full force of breathing, right? As I said, autopilot, we don't even pay attention to it.
Yes, a lot of us are shallow breathers. That's what I know.
Absolutely. Just try holding your breath for 2 minutes and you will know what I'm saying.
Yes.
So breath is essential.
Yes.
So when you take a deep breath and you hold it for a few seconds, you let go. What happens is that from the physiological level, from the medical level, it opens up our channels, the alveoli. All right, these are small air sacs, and some of them have never been ventilated. So there's blood flowing, so there's perfusion going on, but there's no ventilation. So there's ventilation perfusion mismatch. In the era of COVID-19, when we are seeing pulmonary thrombosis, which is blood clots in the lungs, and disease, secondary bacterial infections, you can indulge in deep breathing exercises, which will open up those areas. So the dependent area of your lung and the areas which never open up will open up, and you can increase your ventilation perfusion that way. You can cough up your secretions that way.
Yes.
Improve your lung function. Second thing I advise my patients is prone breathing. So they can lie down on your belly and breathe deeply that way. And that will also open up the posterior part of your lungs. So these are some of the techniques we have employed, during this and other infections. Even if you do not have a COVID-19 pandemic, but you're dealing with an upper respiratory infection or pneumonia, you could employ these techniques to improve your breathing. That's from the medical point of view. But also a lot of people are fearful. There's psychological stress, increased addiction. So I think if what that leads to is increased respiratory rate. So that's activation of your sympathetic pathway.
Mm-hmm.
And what that does is increase your anxiety, A. B, depression can, increase, sweating, increased heart rates, poor decisional capacities,
Mm-hmm.
fight and flight response. That's what it is, increased respiratory rate.
Mm-hmm.
Consciously, when you do yoga, you can lower down your respiratory rate, and right away you feel the benefit
Yes.
of that imbalance which is there in your body, and you can up-regulate your parasympathetic pathway.
Yes.
Slow down your heart rate, slow down your breathing, and gain control of not yourself, but the situation, environment around you.
Yes.
So, in COVID-19, I've done that. I've sat down with my patients because they're very fearful.
Mm-hmm.
Let's do breathing right now. Let's do some deep breathing
Yes.
right now. And I think people love that because they love the interaction. They love the fact that as a physician, I am caring for them.
Yes.
And I'm taking time out of, we are busy, we are taking out time and sitting down with them, particularly in an era where no one is allowed to meet them.
Yeah.
They're relative in the hospital.
Yes.
It's only the patient.
Yes.
So I think if people do that, and more physicians start doing that, I think it will have immense benefits.
Mm-hmm.
And for themselves too, you feel better too.
Yes.
That's mindfulness, right? That's mindful behavior right there.
Yes.
So that's what I was talking about, the third component of yoga, right? When you become aware that you're part of this greater self, you become mindful.
Yes.
So, these are the techniques, which one can employ.
Yes.
And feel better themselves and the people around them.
Yes. Yes. On the point where you said that, you become aware of the bigger picture of your life. It reminds me of the spiritual teacher, Ramana Maharishi. Somebody asked him, how can I help others? And his response was, there are no others. We are all deeply, rootedly connected to each other. So I think the satisfaction, the fulfillment that you get by that extra, what you're putting in is not many people can understand, but that's just so immense.
Yes, absolutely. I mean, and now there are trials and studies which have looked at that.
Yes.
From the scientific point of view, that there's release of happy hormones.
Yes.
Not just with exercise, but also the process of giving.
Yes.
So if you indulge in giving, there's a release of happy endorphins. There's improved physical well-being, mental well-being. So act of giving and mindfulness is immense.
Yes.
The whole, everything is connected,
It is.
When you look at, when I talk of mindfulness, you look at the salmon run, the Pacific salmon, all right? It travels 3,000 miles to reach the river where it was born. So it travels from the ocean, the Pacific Ocean, and travels inland all the way where it dies. But in that process, it is food for 200 animal species. And when it dies, it releases the organic matter and phosphorus, which leads to the growth of those trees. So this is called mindfulness. If you look at it that way, if you're advanced, you will realize what I'm saying.
Yes.
This is the connection between an animal, which is in the ocean, and the 200 species, and the river, as well as the trees.
Yes.
So this is what will happen to you. You will start understanding these intricacies and enjoying nature. You will start enjoying nature the way it is. And this is what I mean when I say enjoy life. This is what it is.
Yes.
Understanding the deeper aspects of life.
Yes, I totally agree with you. And I think the connection you feel with nature, with Mother Nature, is so immense after practicing. I say yoga once a week, yes, good for your body, but yoga as a daily practice transforms you.
Yes, absolutely. It's a transformative practice. It's a tool for transformation.
Yes, absolutely. Well, I thank you so much, Shubh, for joining us on this, and I'm sure our audience will have many questions. I would request my audience to put the questions here. We won't take it now, but Shubh and I will be happy to get back to you on any questions you might have, any specific questions you might have. feel free to reach Subh or I, and we will be happy to do that. So thank you so much with that. Namaste.
Thank you, Namaste, Sangeeta. Thanks for having me today.
Video.
And
Yes.
I think you're doing a wonderful, wonderful job. And I also wanted to say that people should go to these programs. They should come because when you do it together,
Yes.
rather than doing it alone, it's harder. So, please come join us. And I think together we can learn more and be happy and healthy. So thank you so much.
Thank you. Thank you, Shiv. Have a wonderful rest of the evening.
Bye bye.
Bye.